Hi, my name is Sherm Severson, Director of Education at FM Ambulance Service in Fargo, North Dakota. In this short presentation, we'll discuss some of the most common errors people make when using automated external defibrillators. We'll discuss when the AED should be used, why an AED might not deliver shock, why it is important to avoid vibration or movement of the patient when an AED is analyzing a heart rhythm. We'll also look at environmental concerns, such as extreme heat or cold. Additionally, we'll discuss electrode patch placement on the patient's torso, as well as the importance of checking the AED for expired patches or batteries.
AEDs should be applied to patients who are unresponsive and not breathing. They should not be applied to people who are awake, even if they have chest pain. They should not be applied to people that are having a seizure or other medical emergency. These people are still breathing.
Your machine is not malfunctioning. An AED will not shock every person that you hook it up to. AEDs only shock two specific rhythms: ventricular fibrillation and ventricular tachycardia. There are many other heart rhythms that a patient could be in, and the AED will not shock these rhythms. If bystanders ask, "Why aren't you shocking him?" you can simply explain that not everyone needs a shock.
When the AED is analyzing, it is very important that you make sure there is no movement of the patient. This includes pulling over to the side of the road if you are in a vehicle while it is analyzing, and making sure there is no unintentional vibration of the patient while analyzing. This unintentional vibration may cause the machine to misread the rhythm and give an unnecessary shock.
Remember, the patches and battery on your AED will expire. It is a good idea to check them at least once a month. If they are expired, contact Marriage and Medical, a division of FM Ambulance Service, and they will help you get the appropriate patches and batteries for your machine.
If you have to store your AED in a cold place, you may have patches that don't stick very well because they are frozen. You can try to warm them up by rubbing them between your hands. The battery may also be slower because the AED has been stored in the cold for so long. The AED will still work. It may just take longer to analyze and charge. If the AED has an LCD screen, the screen may not work when it's cold, but the AED will still work.
This is the perfect place for the patches, but not the only place. As long as you are making a line through the heart, the patch placement should be okay. For small children and infants, you may not be able to fit both patches on the front. If this is the case, you should never cut the patches. However, there are other ways to make them fit. You can place one on the front and one on the back directly over where you think the heart is. Some AEDs in our area carry pediatric patches. If your AED has pediatric patches, you can use them on children and babies. If your AED does not carry pediatric patches, and most AEDs in our area don't, then you can place the patches on the front and the back over the heart. Some AEDs use pediatric reducers and should be utilized on patients less than 8 years of age.
Thank you for viewing this presentation. If you have any questions related to the use or maintenance of an AED, please contact the Emergency Medical Education Center at FM Ambulance.